Welcome, and I'm Dr. Clarissa Beiting, and I'm here to discuss some post-op care for simple procedures like hysteroscopy, maybe some procedures like the Bulkamid, which is done for stress incontinence, or bladder Botox. So minor surgical procedures that you will do at the outpatient surgery center. It may be done in the hospital for other reasons, but we just want to go through a few recommendations for post-op care on this type of surgery. First, we'll just talk about pain relief with minor procedures. Kim, what do you see most patients tend to do?
Most patients tend to do very well with pain for these smaller procedures. So if it is safe for you to take, we do recommend ibuprofen and Tylenol, non-steroidal anti-inflammatories over the counter. Again, if you don't have kidney disease or anything prohibiting you from taking these, you can kind of alternate them. They can help with discomfort with like feeling pressure or just kind of that minor pain. If you are having, more severe breakthrough pain, we can
do something stronger. Yeah, I feel like most patients, they don't need a narcotic for these types of procedures, so we try to avoid those as possible. But again, everybody's situation might be a little bit different. So non-steroidals like an ibuprofen, which we tend to give prescription strength of those for at least the DNC and ablation procedures, tend to be enough for that. Let's see, vaginal bleeding, you do tend to have that after the DNC procedures. You'll have a little bit more with the bladder procedures, but it's very, very light. Obviously, those are different areas. You'll have very little bit of bleeding from around the urethra with the bladder procedures, with cystoscopy, and then with the DNC. Kim, do you ever hear of anybody with problems with bleeding?
Usually just like the first 48 hours after. It's common to have usually just very light or spotting, kind of like if you remember when you like kind of the end of a period, just very light, like maybe you stand up, you do a little something, you may have a little come out.
Yeah.
And usually most patients do really well with super thin liners just to kind of monitor that.
Yeah, so thin liners are typically enough for these procedures, so you shouldn't have too long. And I think usually 3 to 5 days tends to be an average for the bleeding on that. As far as intercourse after these procedures, the Bulkamid and the bladder Botox, you can resume within 24 hours. The DNCs, we do like you just wait for a week just to let healing and just to help with comfort as well. So I find that's a good recommendation on the intercourse after that. What about tampons? Do we usually tell them to?
No, we usually hold anything like that for about a week. And again, you can buy those very thin liners in the store and use those to kind of monitor bleeding versus a tampon.
Right. So then activity on the minor surgeries, I feel like you can get back to normal pretty quickly with those. Now we know that you will have a little anesthetic, so that night of surgery, day of surgery, we don't want you to drive home. But what do you feel like with exercise? When do you think they can get back to exercise?
I think that's one of those situations where a lot of patients, I just advise them just kind of listen to your body. Some people are a little bit more tired, but you kind of resume when you feel like you have your energy back. Just kind of start light and work your way back up and give yourself some time. And, if it doesn't feel good, if you need to take some more time, back off and give yourself some more time.
Yeah, I feel like that's good too. A lot of people ask about work. I feel like most patients can return to work at 24 hours, depending on what you do. Same with exercise, like Kim said. I think listening to your body, and if you need extra time, just take that time to heal. Typically, bowel movements and bowel care doesn't get a lot disrupted with these minor procedures, but some patients may need like a stool softener or something over the counter during those procedures.
Just again, increasing water intake is so important to help flush yourself after any kind of procedure and help with the bowels as well.
Yeah, and then what kind of post-op cause or complications do you hear from patients, or what should they be looking for?
So the light vaginal bleeding, spotting, 3 to 5 days is one thing that we do hear from the patients. And again, just you want to monitor that. If you are using a light pad and you would have saturated in an hour or less or have any symptoms, please let us know. Excessive, heavy, prolonged bleeding, that is not common at all. But again, if it does happen, we want to hear from you. If you have any discolored vaginal discharge, odor, or itching, please give us a call.
Yeah, I feel like sometimes a little vaginal irritation is a very common side effect. A lot of that can be from the soaps, the cleansings that we do during the procedure. Urinary tract infections aren't too uncommon, so if you have a persistent burning with urination, of course, short-term burning is totally normal. But if you're hitting day 2, day 3, and things are getting worse, let us know. We may have you come in and check a urinalysis on that. Usually the pathology will come back at the week after the procedure. We will contact you, either go through that with your post-op visit, which has already been pre-scheduled, and we'll do anything that we need to after that. For endometrial ablations, it's not uncommon. It's pretty typical for patients to have a yellowish pink discharge for a few weeks. It can even be up to a month or 6 weeks. Most patients don't have a lot, but intermittent, we call it serosanguinous discharge, is a normal finding. When you would want to call us if you start having any odor associated with that, any foul odor, then there could be an associated infection with that.
Yeah, if anytime you get a fever or just don't feel well, nausea, vomiting, please give us a call. We would like to hear from you.
So thanks for your attention, and if you have any further questions about anything, just feel free to call us in the office.